Welcome to this last video in Chapter 1. Here we'll be discussing three main topics. We'll be talking about body cavities, serous membranes, and abdominopelvic regions. Body cavities first. There are actually two separate internal body cavities that protect your internal organs. They're close to the environment and isolate your internal environments from the outside world. They provide a high degree of protection for most of your internal organs, and there are two main body cavities, the dorsal cavity and the ventral cavity. We'll talk about the dorsal body cavity first. The dorsal body cavity's main job is to protect your nervous system, and it's actually divided into two separate subdivisions that probably makes a little bit of sense when you think about this intuitively. The cranial cavity encloses your brain. The vertebral cavity encloses your spinal cord. On the next page, we're going to see a figure of all the body cavities. I want to focus your attention just to the area in yellow. Up top, we see the cranial cavity. This is where your brain is found. And down the back, down the center of the back, we have a vertebral column, which is where you find your spinal cord. The ventral body cavity holds most of the body's internal organs, sometimes referred to as your viscera, and it's actually separated into a top and a bottom part, and the dividing line there would be the diaphragm. Above the diaphragm, we find a thoracic or chest cavity. Below the diaphragm, we find a region that's referred to sometimes as the abdominopelvic cavity. Sometimes the abdominopelvic is broken into abdominal and pelvic, and we'll talk about each of those kind of in their own turn. The thoracic or chest cavity is divided into several separate subdivisions. You have two lung spaces or pleural cavities. Each one of those contains a lung. Of course, there's one for the right lung and one for the left lung. Between the two lungs is a space known as the mediastinum, where you find a space for your heart known as the pericardial cavity, surrounded by membranes, which we'll talk about in a few minutes. This is going to be surrounded by all of your other chest organs. The pericardial cavity is the space where you find your heart. Below the diaphragm, we have a region known as the abdominopelvic cavity. And the abdominopelvic cavity has got two main regions: the abdominal cavity, where you find stomach, intestines, spleen, liver, pancreas, and all the other abdominal organs. Below that, which is actually below your line of your hips, you find your pelvic cavity containing the urinary bladder, reproductive organs, and the rectum. On this page, we can again see all the body's organs. In side view, we see the thoracic cavity above the diaphragm, below the diaphragm, the abdominopelvic cavity, and at the very bottom, just the pelvic cavity. On the right-hand side, with a front view, we see the thoracic cavity again above the chest. We have a pleural cavity for the left and the right lung. We have a superior mediastinum where you would find your thymus and part of your esophagus, as well as your trachea. And below that, in between the two lungs, the pericardial cavity in the mediastinum, where you're going to find your heart. We now come to the diaphragm, and below the diaphragm is the abdominopelvic cavity. The abdominopelvic cavity can be divided into the abdominal cavity, which is where you would find your stomach, your intestines, your kidneys. Below that, below the line of your hips, you would find the pelvic cavity. Next, we're going to talk about membranes. Most of the internal organs are surrounded by a type of membrane known as a serous membrane. The word serous refers to being like serum. These have a serum-like fluid between double-layer membranes, and these provide a very friction-resistant membrane covering protecting most internal body organs. There are several discrete layers here, and we often describe these by terms that you need to get familiar with. There's the parietal membranes, known as the parietal serosa. These actually line the internal body cavity walls. And then we have a space, and then following the space, we've got a membrane covering the internal organ itself, known as the visceral membrane or visceral serosa. Those two layers then get separated by a space that's filled with a fluid known as serous fluid. It's a thin plasma-like fluid that protects the internal organs. And that fluid is actually secreted by the membrane layers. So let's have a quick discussion of serous membranes. They're actually named for the organs that they're associated with. Each has got a parietal layer, which is going to be attached to the body wall, and a visceral layer attached to the organ itself. The first membrane system we'll discuss is the pericardial membranes, which make up the pericardium protecting the heart. Another group of membranes protects the lungs, and we refer to those as the pleura. Finally, we have a layer of membranes, or a set of membranes protecting the internal organs, and those would be the peritoneal membranes. Those line the abdominal pelvic cavity. Generally, these membranes are, again, kind of a double layer separated by a space, and this image of a fist in a balloon is a great example. If you've got a partially inflated balloon and you push your fist into it, then you can imagine one layer of that balloon is right up against your fist. The next layer will be the outer portion of the balloon, and the air in between those two spaces would represent the serous cavity, which inside your body would be full of fluid. The picture seen here in the chest illustrates the exact idea that I'm talking about, where we have a double layer membrane separated by a space. The layer right up against the heart would be the visceral pericardium. The space outside that would be the pericardial space. And then the outer membrane around the entire container of the heart would be the parietal pericardium. So from the inside out, visceral pericardium, pericardial space, and parietal pericardium. You have a very similar set of membranes around the lungs, but instead of being called pericardium, they're instead called pleura. Our next topic will be the regions of the abdomen. And this is actually divided in two separate ways. The topics here are often discussed whenever you're in a clinical examination setting. In this picture, we see the abdomen divided into four quadrants: the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. Let's say, for instance, in a few years you're in a clinic and a patient is coming to see you. They're complaining of right lower quadrant pain. One thing that you might suspect here would be an inflamed appendix, which in this image we can see. Things you would find in the right upper quadrant would include a portion of your liver and the gallbladder. Things you would find in the left upper quadrant would include your stomach, part of your colon, and some of your small intestines. And things you would find in the left lower quadrant would include more small intestines, some large intestines, the sigmoid colon, and of course, portion of the bladder. You can be more specific, though, if instead of talking about quadrants, we talk about 9 divisions. Imagine our tic-tac-toe board. And looking at that tic-tac-toe board arrangement, we see 9 separate regions in the abdomen we can discuss. I'm going to go from the top right corner to the lower left. So I'm going to work my way across the top, across the middle, and across the bottom. Starting at the top right, and again, this is the patient's right, so it's on your left side. This upper right corner is known as the right hypochondriac region. Coming to the middle top, we have the epigastric region, which is near the stomach. Coming on over, we have the left hypochondriac region. Coming to the middle left, we have the right lumbar. In the middle, the umbilical region, and of course the navel is in this area. Continuing on, we have the right lumbar region. Coming to the bottom left corner, our left, the patient's right, we have the right iliac, sometimes called the left inguinal region. Below the navel, in the very center on the bottom, is the hypogastric or pubic region. And continuing to the far corner, we have the left iliac region. And as you look at the graphic on the right-hand side, you can see some of the internal organs in this arrangement. Or of course, you can be a little bit more precise as you're describing where patients are feeling discomfort with the 9 abdominal pelvic regions as opposed to the 4 quadrant region. Other body cavities we need to discuss. Some are exposed to the outside world and some are not. For those that are exposed to the outside environment, we've got the oral and digestive cavities. Of course, your mouth is open to the outside world. It's where you bring food in. At the other end, of course, we've got a rectum and an anus to eliminate feces. Your nasal cavities are exposed to the outside world. It's where you bring in most of your air. Your orbital cavities, you may not think about this, but your eyeballs set in oral cavity spaces. Your middle ear cavities are connected to the outside world by being in touch with your pharynx, the back of your throat, through your auditory or eustachian tubes. Now, not exposed to the outside environment, we have spaces in our joints known as synovial cavities. This is going to be the end of chapter 1. Thank you for your time.